includes 3 findings that are logically and functionally related and serve to reinforce each other. We first highlight management failures that have persisted over time and across programs. We then describe the problems with foster parent recruitment and retention. And last, we end with inadequate staffing. Over 11,000 children are entering the Oregon foster care system every year. These children are one of the most vulnerable populations in our state. The supply of suitable foster homes and treatment facilities for these children is falling, leaving children entering foster care with increasing limited placement options that are sometimes inappropriate and unsafe. Since 2011, the number of available foster homes has declined 15%, and the total number of homes with foster parents who are not related to the children has declined by almost half. These career foster parents are the backbone of the system, and their decline is a substantial problem. They serve more children for longer average time spans, they receive more training, and care for a wider variety of children, including those with special needs. The foster parents who serve these vulnerable children are struggling. Foster parents told us they do not feel adequately supported by DHS in dealing with the challenges of children in their care. And at the same time, the agency is asking foster parents to take on more duties as caseworkers struggle to manage their caseloads and to take on more children as the supply of homes dwindles. The agency has also increasingly resorted to housing children in hotels, often leaving inexperienced caseworkers who work full-time schedules during the day to supervise them during the night. From September 2016 to July 2017, DHS has placed 189 children in hotels at least 284 times. The average length of stay was 7 days. Several of these instances involved the same child being placed in a hotel multiple times. One child was placed in a hotel 9 separate times in a 14-month period. DHS did not formally track the hoteling of children until September 2016, only after a federal lawsuit was filed. We found the data that they were tracking was not always complete or consistent or reliable, and we were unable to conclude on behavioral needs of children who stayed in hotels, as over 60% of them did not have a record of a behavioral assessment. We also found the agency is not tracking costs. We estimated the cost from September to 2016 to July 2017 to be over $2.5 million. Foster children and families are served by caseworkers who are doing the very best they can with limited resources. Child welfare offices are chronically understaffed, and they are currently short approximately 770 caseworkers, supervisors, program managers, and support staff who are all needed to manage caseloads. Caseworkers are overworked. They're struggling, and many are leaving the department in high numbers. Caseworkers are not able to have meaningful visits with children under their supervision even once a month, the bare minimum. Caseworkers are overwhelmed with high caseloads, which have led to rampant overtime use, high turnover, and frequent use of medical leave for stress and burnout. In one office we visited, 8 caseworkers in a single unit were out that month on stress-related medical leave. This means that their caseloads have to be transferred to the remaining staff who already have full caseloads. We shadowed many caseworkers during the course of the audit and found the work emotional, exhausting, and heart-wrenching. As a result of the turnover, over a third of the child welfare staff are in their first 18 months on the job. Many of these are getting full caseloads before they've even completed full training. DHS spends an estimated $28 million per year on training and onboarding new caseworkers, due in part to the large turnover. In light of these severe issues, we found management's response to these problems has been slow, indecisive, and inadequate. DHS and child welfare managers have not strategically addressed severe and chronic caseworker understaffing. They have failed to provide the legislature with accurate staffing data for funding and decision making. They have not strategically addressed the recruitment and retention of high-quality foster parents, and they have not developed a statewide recruitment strategy, instead relying on a piecemeal outsourcing of recruitment that misses much of the state. For over a decade, management's response to the crisis and scrutiny has been to reorganize the system, not effectively plan to fix it. Several substantial reform efforts have been poorly planned and executed, then abandoned. This lack of strategic management has helped fuel an increase in lawsuits and legal payouts totaling $39 million since 2006. Management problems are widespread.